my great pleasure to introduce our own Dr. Cooke, who has assumed a new role recently. As I think all of you know, he served as the program director, the inaugural program director, and actually developed our I6 training program in cardiac and thoracic surgery. But today he's going to talk a little bit about his new role as and some of the activities as the Vice Chair for Faculty Development and Wellness. Dr. Cooke, for those of you who don't know, is a native Californian. He was an honors graduate of UC Berkeley before matriculating at Harvard for medical school. He loved the snow so much that he stayed in Boston at Mass General for his residency in general surgery at Mass General before going on to the University of Michigan for his cardiothoracic fellowship. We were really thrilled to recruit him back to UC Davis and to California to lead our thoracic surgery division, and promised that we would give him a snow experience every once in a while, so that made him closer to Tahoe by virtue of joining us here at Davis. But he has been a tremendous leader in the Department of Surgery. I think many of you appreciate his never shy comments at Grand Rounds and at M&M about the importance of handling issues of the chest and thorax in the most up-to-date and expert way. So I tapped him not too long ago to help us really have a laser focus on the issues of faculty development as we continue to evolve the Department of Surgery and Wellness. Little did I know that that was going to be an even more important topic as we entered a new era and a new normal for all of us here. So I've spoken enough. I want to hear from the expert, and I look forward to welcoming Dr. Cooke this morning. Thank you, Dr. Cooke.
Well, thank you, Dr. Farmer, for those kind words. As you know, everyone likes snow until you have to shovel it before you pre-round. So today I'm going to talk about faculty development and our Department of Surgery Succeed program, which is geared towards faculty development and also to the support of trainees as well, residents, medical students, anyone affiliated with the House of Surgery. I just want to say I feel like what our athletes are going to feel like in a couple of months, talking to a near empty arena while everyone watches you on their smartphones. So I have no disclosures, and I just want to say it's a wonder pleasure here to be in a grand tradition of Grand Rounds that dates back to the founding of Zoom and WebEx. And I usually present Grand Rounds at the end of the year in May or June, and that way I could take the opportunity to congratulate our graduates. Thank you for all the hard work and that you've done to educate yourselves. And this is a picture of one of our graduations here. So objectives today is to understand the challenges of faculty development, review requirements of faculty promotion at UC Davis, and review the barriers for faculty promotion for specific demographics especially, and introduce the goals and resources of the Department of Surgery Succeed program. And I always misspell Succeed, or I fear that I misspell Succeed, so it puts me in sort of a cycle here. So why are we here? And when I ask this, I don't want you to kind of grow a goatee and twist it, but it's why are we in academic medicine? And this is a nice little thing from the AAMC, and I thought that was pretty germane in terms of why I think most of us are here, really to educate the next generations of physicians and scientists, conduct research linked to improving patient care and community needs, and providing high-quality patient care, especially in local and often underserved communities. And this is not ranked in order. This is just sort of the gestalt, pretty much why we all are here, really with the emphasis on patient care and restoring health, especially as surgeons. But as David Axelrod once said, hard things are hard. And academic medicine is very hard, it's very, very difficult. But I think we all knew that as we entered academic medicine. So if you Google academic professor, this is what comes up, and people do this all the time as sort of a diversity thought experiment. And with the algorithm, it starts getting more and more diverse as years go on. I tried just Googling professor. I just got a lot of pictures of this guy. If anyone who watches Netflix, this is the professor from the, what's that movie, the Heist, which is like the hot movie, the hot series on Netflix, which I just couldn't get into. I'm just not hipster enough. I'm just a daredevil, travelers, altered carbon type of person. I'm going to try to get into Ozarks, but we'll see what happens. When you Google academic health professor, you start seeing more white coats and general perception. But the reality, these are sort of the face of academic professors at UC Davis, sort of the wise individuals who really were able to successfully navigate the academic system. But to become a full professor, you need to get to associate professor, which is an incredible milestone. And also difficult to navigate. And then you also have to sort of be successful as an assistant professor to get to associate professor, and not get frustrated and not drop out before becoming an academic professor. And this is it's a ladder with many steps to get to the top, and with a lot of hard work at each step. So is there a blueprint? Is there sort of a secret manual or a book of secrets to get to a full professor and academic success? So this is an interesting study put forth by the Society of Black Academic Surgeons. And what this is a curriculum vitae benchmarking initiative where they took the leaders of SBAS, so current and past presidents, and current and past leaders such as vice president, secretary, treasurers. And so they looked at 20 CVs, and they looked at sort of their academic journey and kind of developed a sort of a consensus. And members who became leaders doubled their involvement in surgical societies from years 5 to 10. So as they progressed through their careers, they started outreaching more to different surgical societies and became leaders in those societies. They saw a stepwise increase in academic productivity over the first 10 years, indicator of career trajectory. So we always say 5 publications per year, but as they developed their networks and then became multidisciplinary researchers, those numbers of publications sort of exploded. And then there are deans who have been presidents of SBAS, and they found that the deans achieved more grant funding than division chiefs or department chairs. And then the department chairs didn't necessarily have statistically significant more grant funding than the leaders who were division chiefs, but the deans definitely did. But the reality is that there is no blueprint. Each person has their own academic interests and their own sort of creative work, and there is no sort of this is what you have to do. But there are expectations, and these are expectations of the University of California in regards to merit advancement and promotion within the University of California system. And that's key here. When I say University of California, when I was growing up, that meant Cal. If you're from LA, that's UCLA. If you're from the Sacramento County, Central Valley, before Merced, it's UC Davis. But really, there's an office in Oakland where Janet Napolitano lives that kind of serves as a centralized voice for all of the University of Californians. And there are some differences in academic promotion, but there is kind of a master manual that sort of guides all the UC campuses. And in a way, that's good, because then there's no sort of dark secret pathway to professorship. It's really quite transparent, and you can look it up online, and there's a lot of duplicate information online, whether it's here at UC Davis, on another campus, or at the Office of the President. So criteria for promotion by academic series at UC Davis. And we're going to kind of delve a little bit deeper into the academic series. Many of you I've onboarded, and so we've had a longer conversation. We have Colin Clancy, usually every other year, to come talk to us to really do a deep dive into the promotions process. And I'm more than happy to talk in detail offline with anyone. But to kind of give you a sort of an overview, these are sort of the 4 domains that you need to serve as success. And for the trainees in the audience who are interested in academic medicine, if you go to another institution, it may be a bird with different feathers, but at the end of the day, it's still a bird. And so many of the promotion criteria at those institutions are similar to these promotion criteria if just presented in a different way. So here we have investigative research or creative work. And we'll talk briefly about the new health science clinical professor requirements in that. Teaching, clinical service, so caring for patients, and professional service. And within that, there's contributions to diversity, and which is relatively new. And you have to show in many, if not all of these domains, some aspect of contributions to diversity. And we'll talk a little bit about that as well. If you want to be hired at University of California, so at the University of California at all different campuses, you have to show that you have contributed to diversity in some way at your previous stop. And so that includes trainees and new graduates who are finding jobs as well. But we have to understand that we're in a global pandemic. And you can have a grand rounds alone on research and the ability to do research during a global pandemic and how it affects different individuals differently. And the University of California has understood this, and they've developed sort of guidelines during this global pandemic. These are all available online here, Guidance for the Committee of Academic Personnel Oversight on Advancement Actions. But what the university wants to tell you is that they are pushing forward with merit advancement as well as promotions during this global pandemic. But the key here is we believe the impact of COVID-19 on academic senate and federation members' ability to perform their academic duties qualifies as an effect of a natural disaster. Therefore, such requests for a 1-year extension on the basis will be regarded favorably and without prejudice or penalty. So you're able to extend your promotion clock during this time. And then this, as you know, obviously they'll have to reassess this in a year because this may not be a temporary global pandemic. This may be like a 2-year global pandemic. Hopefully not, but it very well could be. And then obviously this will be updated appropriately. But the bottom line is that the powers to be understand that these are unprecedented times. Well, not unprecedented, but these are difficult times, and that it's difficult to navigate your career if your kids are at home and your loved ones are sick, or you are here working all the time caring for our patients. So this is a little bit of a breakdown of our department in regards to academic series. So about half of our department is what's called Clinical X, and we'll talk a little bit about that. With 14% in residence. Most of those 14% are professors. 11% are, 22% are health science clinical professor, and then 11% are other. And that other includes our volunteer clinical faculty, such as our military colleagues, and adjunct faculty and other series that provide value to the university and our communities. So this is sort of a nice chart summary of the expectations of the different series. And I highlight these series because they serve as sort of the bulk of what our department represents. So as I said, we have what's called health sciences clinical professor. So that's oftentimes what you hear is HSCP. As you know, none of these have salary support by state funds. And that sort of quote unquote tenure that you hear. Tenure means different things. It took me, I'm not sure I understand tenure now, but I've been struggling to understand tenure for ever since I was a kid and you saw the professor on Gilligan's Island. And I realized that tenure means different things for different people, for different institutions. And from the best of my understanding for tenure here, it means state-supported salary. And that's why none of us, except for ladder rank, may have state-supported salary. And if you think about it, all of us here are revenue-generating academicians. So as part of our academic enterprise, we generate revenue. But there are many academicians who don't generate revenue, but their contribution to education and knowledge and global knowledge is critical and key and must be performed. And therefore, they have, once they hit a certain level of success and productivity, they have to have the ability to perform that research without worrying about making ends meet. And I think that's the simplistic global view of what tenure means. But health science clinical professor, they're part of what's called the academic federation. I'm not going to go much into federation and senate. There's plenty of information online to explain those, and I can always explain it offline. Classically, health science clinical professor are called the clinical educators. Their investigative work really supports the department's investment and creative mission, includes enrolling in clinical trials, quality improvement projects, hospital operations systems. Extramural funding is not required for merit advancement and promotion. And it used to be that scholarly publication was not required for merit advancement and promotion. But that has changed, where there's now a publication requirement for HSCP for merit advancement and promotion. But that publication requirement can be case reports, book chapters, and other novel online educational material, and doesn't necessarily need to be high-impact journal publications. Teaching. Now, this is a great emphasis for HSCP track, is the ability to educate. And what I always say is the teaching has to go beyond, I'm just showing you how to throw the stitch in the operating room. It includes whether you're a program director or associate or assistant program director, where you're actually leading a session at surgery school, or you're developing a curriculum or a simulation curriculum or what have you. So it has to be teaching on sort of a higher level. And then clinical service, so creating a clinical enterprise, whether you're developing a center or developing a new service line or supporting an existing service line. That's the clinical service. And then also administrative community work, serving on committees within the hospital and abroad. And then also contributions to diversity, you have to show that. Clinical X, what does that X mean? So I am an associate professor of clinical surgery. So the X is surgery. You could be an associate professor, assistant professor of clinical medicine, or a professor of clinical pediatrics. So the X is your designation. You're part of the academic senate, clinical investigator, and educator. You have to have some sort of thematic, hypothesis-driven work. You're expected to publish now in journals, peer-reviewed journals, but extramural funding is not required for your merit advancement or promotion. Now, in order to do research, you oftentimes need to be funded, and therefore many people in clinics do get extramural funding because in order to really chase their hypothesis-driven work, they need funds to do that. But it's key here that extramural funding is not required for merit advancement or promotion. Teaching as well, clinical service, and administrative community work is required, and contribution to diversity. In residence, These are research scholars and educators. So here, their clinical percentage and their research percentage are oftentimes inverse what the other series are. So they may be anywhere 50 to 80% research and only like 20 to 50% clinical. And in this case, again, independent thematic work, but extramural funding is required for merit advancement and promotion. And it's really to be expected. And you might imagine why that is the case, because if you're 80% research in a branch of medicine that is a high revenue generation branch, it's oftentimes difficult to support yourself over a long period of time if you're not clinically active. So therefore, extramural funding is really required for you to achieve your thematic goals. Teaching, but oftentimes this teaching may not be in the clinical sphere, but it may mean postdocs in your lab, residents coming into your lab, and students coming into your lab. And when I mean lab, I mean global lab, whether you're a health services researcher, clinical trialist, or a basic scientist. Clinical service here is optional, and optional means that is not the dominant aspect of your career here, but it's a component of your career here. It's going to be hard to develop a clinical center or lead a clinical service line if you're in residency. Not impossible, but it's difficult. And then administration is required and contributions to diversity. And then latter rank is many of our faculty here, whether they're MD or not, are really quite research and supporting the research enterprise. And clinical work in this may be minimal to zero. But again, extramural funding and community work and contributions to diversity. So this is sort of a big picture overview. And this is where our department kind of sits. So 50% of our department is full professor, and which is really quite interesting. I came across an article recently looking at the cardiothoracic surgical workforce, and the median age of a cardiothoracic surgeon is 56. So James is entering the profession at the right time, because jobs are pretty much guaranteed as we are aging out. And then that's not uncommon for a lot of different surgical subspecialties. I believe general surgery might be a little bit younger, but I think it's just because it's a bigger, more diasporic specialty. But neither out of the case, there is a projection of a massive shortage of surgeons across the board, especially general surgery and especially cardiothoracic surgery. For some reason, neurosurgery has a suspected surplus coming forward, so that's interesting. So about 50% full professor, and then 33% assistant professor. So we're kind of bimodal here. And then we have what's called merit advancement. So usually it takes about 6 years to become a full professor. But between those 6 years and 2-year intervals, you do what's called a step promotion. And usually there's one step, but now we have step plus. We have 1.5 steps or 2 steps. I'm not going to go deep into the reason behind the steps, but the big picture, the whole step plus paradigm is used to generate pay equity across the University of California system, and more part of that sort of transparency activities of the University of California. Dr. Clancy, when she comes and talks every other year, provides a more in-depth. And then I'll get into, there's other resources here at the university to learn more about this. But really, the most common step is one-step advancement, and you show a balanced record, an appropriate rank and step, with evidence of doing well in each of those domains we talked about. 1.5 step advancement. A 1.5 step advancement requires a meritorious record with outstanding achievement in at least one of those scholarly domains and competence in the others. And then 2-step advancement, which is less common and rare, will require a meritorious record in all areas of review with outstanding achievement in at least 2.
David, I just want to, you misspoke briefly. It's 6 years to associate professor.
Yes, that's why. Did I not say that?
Yeah, you said professor.
Yeah, so it's about 6 years to associate, 12 years to professor, which is kind of what the most common time frame here. If you win a Nobel Prize, in your first couple of years here, then most likely you might get a 2-step advancement. So, no, I'm just joking. So this is sort of a nice little table that kind of gives sort of the clock here. So this describes in-resident, clinics, and HSCP. We're all faculty here. The bottom line is that you get a sort of a preliminary assessment at 3 years to kind of determine how well you're doing. Are you on track to become an associate professor? And there's sort of 3 kind of outcomes of that. One is that you're not on track. 2 is that you're definitely on track. Congratulations. And 3 is that you're doing well. Most likely you're on track, but this is what we recommend to make sure you get there. And that's the most common result of that assessment. You have 8 years to make associate, really, and then and that's sort of the clock to get associate. Most people get associate within 6 years, but you really have 8 years. And then you are eligible for different extensions based on issues and needs, and that includes the current COVID-19 environment or anything that's going on in your home base. Everyone undergoes a 5-year review, and that's where that sort of process occurs, and with you being promoted after the end of that 5-year review at year 6. And so this is sort of the clock in the timeline. We could go into more detail later. I do this at onboarding in regards to what if you do not make that 8-year window and it doesn't look like you're going to make associate. But this is sort of the big picture timeline. And this is the process. And I've sort of distilled this down a little bit because there's other kind of legalese that's in here. But what happens is the dean's office, it's not like the dean is sitting down with all, hundreds of faculty but the dean's office and really compiles a list of eligible faculty for merit advancement and promotion and forwards this list to the departments. And then the department chair's office consults with the faculty member who's up for merit advancement and promotion to start developing their portfolio. If they're looking for promotion, soliciting letters for evaluation. For Federation, there's a special candidates dossier to approve. And then the department chair consults with the department faculty who might meet or discuss candidate's record and subsequently vote on the candidate on whether they should be promoted or what merit advancement. So for the faculty, those are the emails that you get asking you to vote on a candidate. And in those emails are the candidate's personal statement, the department division chief's support letter, as well as the candidate's CV. And I really implore you to all read through those documents, especially as you start preparing your own personal statements and fashioning your own CV. Because obviously there are shining stars within our department, and sometimes it's good to kind of look at what they've done and how they've, just like that SBAS study, look at how they've advanced via their CV. And then also, we're all very humble individuals, and as we like to say, I'm just an old country doctor doing the best I can with what I've got. And we don't necessarily like to talk about what we do and all the great things we do. And I'm here to read your personal statement, your candidate statement. And oftentimes when I read these statements and I look at their CVs, I see a lot of really fascinating, innovative stuff that's left out. And so sometimes it's good to see how other people talk about themselves and present data in a way that's really effective. So then they forward that recommendation to the dean. And another thing is, some of us just kind of rubber stamp 1.0 step advancement, 1.0 step advancement. But if your colleague is really doing great stuff, then you should really reward your colleague by saying, well, maybe they should get a 1.5 step advancement or a 2.0, because the dean's office really look at what the faculty, your peers, have to say about the cool work you're doing. Then the dean forwards this to the faculty personnel committee, and many people in this room and this audience have served on this committee. And this committee makes a recommendation to the dean on the step merit advancement and promotion. And then the dean either approves or disapproves. And then her office then forwards this to the department chair. And then the department chair updates the candidate. Now, the candidate has a right to review and protest or appeal. And that's all baked in here. And then annually at the main campus, the Committee on Academic Personnel conducts a post-audit to look at all of these advancements and promotions. So really, academic achievement, we have a plan A, and it's easy and it's straight, and boom, 5 years, I'm a professor. And then there's plan B, and then there's real life. This is me walking my Labradoodle on the Davis Greenbelt. And so this is a study out of the AAMC, academic medicine, competing risk analysis, promotion, and attrition in academic academic medicine. So they tracked U.S. med school graduates, and they looked at who went into academia, and they looked at who was promoted and who dropped out of academic medicine. So what they found was that they looked at this database, and they looked at who received full-time instructors or assistant professors were promoted, and who dropped out. And they found 27,000 instructors and 17,000 assistant professors. They found that underrepresented racial and ethnic minorities, so underrepresented medicine, compared to white faculty, had lower promotion rates and a greater risk for dropping out. Individuals who received Mentor K awards had a higher chance for promotion and lower dropout rate. And you can imagine that they were in an inclusive environment. Faculty with 100,000 or more debt at graduation had greater dropout rate. You can imagine people leaving to go into private practice. And among assistant professors, women had a greater risk of dropping out. This is a recent survey of the surgery workforce, looking at practice characteristics, job satisfaction, and reasons for leaving surgery. So despite the fact that the majority of respondents were satisfied with their career, like who doesn't like to operate and to research cool stuff, right? About 25% considered leaving their surgical practice. And the top reasons surgeons less than 60 years of old consider leaving practice: overall stress. So 80% of people younger 60. Work time demands, and personal time requirements as they relate to their job and their work. This is a sort of a newsletter, Inside Higher Education. In our own words, they looked at African American faculty members in higher education, and they talked in their own words about why they were leaving academic medicine. And one responded that coalesced these answers. As many of the respondents noted, the toxic departmental climates and routine failure and negligence by those that hold institution power to address various forms of micro and macro aggressions, and female and minority faculty within academia. So really the constant barrage of, in many cases, macroaggressions, but in most cases, microaggressions, eventually led these members to leave academia. So how can we improve this? How can we take my Labradoodle's walk and then guarantee sort of a straight line to success? So one is the Faculty Development Resources. This is a wonderful webpage that I advise you all to take a look at. Colleen Clancy, she's our Associate Vice Chancellor for Academic Personnel, has really put together sort of a wonderful source of information on faculty development, which includes professional development workshops. Here we have getting better feedback, bouncing back after being knocked down, resilience, managing workplace conflict during COVID-19. Our very own Dr. Salcedo and Jean Grumley are leading this workshop this Friday on getting better feedback. There are opportunities for executive coaching here at UC Davis Health, especially for our more senior leaders or mid-career leaders as they navigate the world of middle management, and health and wellness resources as well. So what can we do at the department level? And so Dr. Farmer described creating the Vice Chancellor position of Faculty Development and Wellness. And in that position, we developed what's called the UC Davis Succeed program. And that program is based off of other successful programs in other departments. Specifically, one is University of Michigan. That was developed when Dr. Mulholland was chair, and then is being led to additional greatness by Dr. Dimmick. And it's called the Michigan Promise, and really 6 strategies to really nurture their faculty in the realms of leadership, innovation, community outreach, recruit the best and brightest, achievement, helping faculty achieve their goals, and in creating an inclusive and culturally competent environment. And then there's also additional success here, and that the Succeed program is modeled after UC Davis, specifically the UC Davis Advance program that's involved in the STEM schools on the main campus that looking at to help promote their faculty and success, and also develop a culturally competent environment. So the UC Davis Department of Surgery Succeed program, ensuring surgeon success. Our purpose of the Succeed program is to provide mentoring and support for our faculty and provide them with an environment that maximizes their professional development. Dr. Michael Campbell leads our departmental launch committee, and we'll talk a little bit about that. Dr. Amanda Karani is our departmental wellness director. We get administrative support from Jennifer Goyne, Artie Kumar, and Sonia Kumar. And then in July 1st, we recruited Dr. Luis Godoy, and he'll serve as a departmental diversity and inclusion director. So our activities, we onboard for new faculty, so really provide them sort of a framework of what they're getting into. And then as part of that, we are having launch committees modeled after the launch committees at University of Michigan and the UC Davis Advanced program. So our launch committees, led by Dr. Campbell, he moved these to virtual. They were in-person committees, and he moved them to virtual even before COVID-19, just because, as you imagine, it's difficult to get a bunch of surgeons in a room at the same time. So it provides support and guidance for new first-year and early career faculty as they begin their career here at UC Davis. So that's assisted through Associate Step 1. The committee meets at least once with the faculty member during their initial academic year to facilitate their early professional relationships. And it's based off of what that faculty member's understanding of the role here at UC Davis and what they envision their career to be in 5 years. And then we find faculty members who might be able to point them in the right direction, as well as at least one faculty member outside of the department who fits their rubric to serve as their launch committee. And then in that, we review their individual development plan. And this individual development plan, or IDP, was developed by Julie Schweitzer of the Mentorship Academy, which is sunsetting, but was a valuable resource. And each new faculty assisted to Associate Step 1 must fill out this individual development plan. And it really asks them that you might think are mundane questions, such as, why did you decide to work at medical school? Why did you decide to, what do you personally hope to accomplish in your career? and list your academic series requirements. So it's not surprising that yet some people may not understand what series they're recruited into. And if they don't understand what series they're recruited into, what are the criteria for success within that series? So we really ask new faculty to articulate that so they understand at the very beginning. And then to reconnect with why they entered medical school. Because to become a surgeon is basically like climbing Mount Everest. But then once you get to the top of Mount Everest, do you really understand why you started climbing Mount Everest in the first place? Because there's so many points at Mount Everest where you could die that you're just thinking about survival. And you never realize, well, why did I go to REI Co-op to get my equipment in the first place? The other thing is I asked them to break down their time devoted to each different domains of academic merit advancement and promotion. And many people say, oh, that's impossible. But no, break down what you want it to be, and then break down what it is in reality. Because they might find that they're spending 50% on education, but their series doesn't really demand that, and their goals don't really demand that. And when they look at that, well, maybe I need to dial back on that, and maybe I'm overcommitted. Professional Development Didactic Series. In 2018, we surveyed the faculty, and amongst questions we asked, please select the top 5 topics you would like to attend for a professional development lecture, workshop, or didactic. And highlighted in yellow are some of the highest rated responses. So achieving academic success, merits and promotions, how to be a great mentor, negotiations, cultural competency, finances and academic medicine, institutional and professional society leadership, leadership, vision, strategic planning, dealing with difficult faculty and residents, not like there's any difficult faculty or residents, work-life balance, and examples of research career paths with some write-in categories, again, negotiation and transition to retirement. So based on that, we developed what's called the UC Davis Succeed Didactic Series, and really and then invited thought leaders from around the department and as around the university as well to discuss some of these topics. And many of these have been filmed and are on YouTube. Here's Dr. Ackerman Barger discussing microaggressions. We talked about that article looking at many underrepresented medicine leaving academic medicine because of microaggressions. Here, Dr. Misty Humphreys and I had a conversation on being active in professional societies and leadership and what was our strategies for doing that. And then Dr. Schweitzer talking about how to be a great mentor. This Thursday at 3 p.m., this is going to be a WebEx. We have Dr. Allison Ledgerwood, who's a professor, Chancellor's Fellow, Department of Psychology here at UC Davis, talking about how to get unstuck and her research on negativity bias. So we're going to talk a little bit more about this, but this is this upcoming Thursday. Breaking bread with the chair. So every year I realized that the senior faculty get to talk with the department chair all the time because they're always in our office complaining, asking for more money, or they're in leadership positions, so they have to report to the department chair. And then young faculty and mid-career faculty, because you remember you saw that our department is kind of bimodal. The mid-career are kind of like Gen Xers, right, who are bitter. They don't get to talk to the department as much. So we developed 2 sort of activities, which are kind of dinner settings. One is for early career faculty and volunteer clinical faculty, and the other is for mid-career faculty, so they could hang out with Dr. Farmer and ask questions. And many sort of departmental changes have come as a result of that. Support for external professional development. Dr. Farmer's committed for external professional development for faculty members. There's wonderful products with the AAMC and American College of Surgeons, so I implore you to take advantage of those. Wellness and social events. So what causes organizational burnout? So being burnout within an organization. Unmanageable amounts of work, declining professional autonomy, burden of documentation, and a less emphasis on the traditional values of academic medicine. This is an interesting statement. Thriving is a psychological state in which a sense of vitality and self-improvement fortifies people against the vicissitudes of life. So if you're able to really do the things that you want to do to improve yourself and be successful in your career, then you're able to thrive and manage some of those stressors that I showed you earlier. So coming up this Friday, Dr. Roseby, who's a clinical psychologist, volunteered her time reaching out and said, I know you guys are stressed during COVID-19. I work with corporate entities to talk about the ordinary power of quieting your mind. This is 12:30 to 1 p.m. this Friday. This is the WebEx links. How do we get quiet? How do we pay attention in that quiet? Sort of that mindfulness and being present. You have to work to see the upside. So it's really easy to get beat up and brought down. And just like the hard things are hard, it's hard to work to see the upside and uplift your spirit. But it's what has to be done. There's a reason why Dr. Yellowey's weekly emails is called The Good Stuff, where he highlights good things that we are doing. So again, this is Dr. Allison Ledgerwood. You're going to hear more from her and able to ask her questions coming up this Thursday. But she had an interesting TED Talk on this subject, and we're going to play a little bit of what she has to say here.
Research means to me is that you have to work to see the upside. Literally, this takes work. This takes effort. And you can practice this. You can train your mind to do this better. There's research out of UC Davis showing that just writing for a few minutes each day about things that you're grateful for can dramatically boost your happiness and well-being and even your health. We can also rehearse good news and share it with others. We tend to think, right, that misery loves company, that venting will help get rid of our negative emotions, that we'll feel better if we just talk about how terrible our day was. And so we talk, and we talk, and we talk about the boss who's driving us crazy, and the friend who never called us back, and the meeting at work where every little thing that could go wrong did. But we forget to talk about the good stuff. And yet that's exactly where our minds need the most practice. So my husband, who has this disconcerting habit of listening to what I say other people should do and then pointing out that, technically speaking, I'm a person too, has taken to listening to me for about 2 minutes on days when I come home all grumpy and complaining about everything. And he listens and he says, okay, but what happened today that was good? And so I tell him about the student who came up to me after class with this really interesting, insightful question. And I tell him about the friend who emailed me out of the blue this morning just to say hello. And somewhere in the telling, I start to smile. And I start to think that maybe my day was pretty decent after all.
So you have to work to see the upside and think about the good stuff. And that's why you always get emails from me and others within the department and those who are on social media that looks to kind of highlight the good stuff that all of you are doing and really to reacquaint yourselves with what makes you thrive. Here, restoring health to our patients, innovating, and doing incredible things in regards to research that's really dedicated to the improvements of our communities. So really thinking about what is here that brought you to UC Davis in the first place. So we're going to end up on in the back nine here to talk a little bit about three additional things. One is contributions to diversity. This has created a lot of national uproar with a requirement with UCOP. And then we'll end to discuss a little bit about mentorship and sponsorship. So the goal of the University of California is to achieve diversity and inclusion within its educational environments. And why is diversity important? Because it brings different cognitive perspectives. And really it's about the team structure and different points of view to really provide a successful outcome. So per the UCOP in regards to academia for appointment as faculty in order to get a job here, or to achieve promotion in order to be successful here, the University of California requires all candidates provide evidence of contributions to diversity. And it's stated here to recruit and retain outstanding faculty, search committees, and division committees on academic personnel need to be aware of these requirements and understand how to ensure this policy is being followed in the different domains of success. But you can imagine this is a very controversial statement or requirement. This is Dr. Abigail Thompson, who's the department chair of mathematics at the main campus, and she wrote an op-ed in opposition. Mandatory diversity statements can too easily become a test of political ideology and conformity. I do have a different talk that looks at the data behind diversity and inclusion and how it, in the private sector, definitely diverse boards outperform those companies that do not. But there's a statement here by our Chancellor May and our Vice Chancellor Toll, where they state true commitment to diversity, equity, and inclusion is active and not passive. Diversity, equity, and inclusion is a skill set and recognize an appreciation of difference in backgrounds. The University of California states that diversity is integral to the university's achievement of excellence and enhances the ability to perform its mission. And that's key here. It's the mission of the university. Not everyone has a right to work here. And within that premise is the acknowledgement that the attention needs of our evolving is to support the broader mission of higher education. So that's the mission of the university. So what can you do? I mean, I'm not Martin Luther King, and you might say to yourself, some of you might say that you are, but most of you aren't. But you probably are already contributing to diversity, whether you know it or not. So again, we must do it within these four domains. And we recently had Dr. Arga Gonzalez here to talk about gender diversity and equity. And this is a tweet from Dr. Farmer. And a key aspect of her tweet is this: rigor. Great Grand Rouse bringing rigor to a difficult topic. Rigor meaning data. So whatever you have to do, it has to show some data. These are some examples of candidate statements that I've extracted. And I've changed information around and some details and et cetera, so it doesn't really identify the individuals. But this is a statement on research. I've authored 10 peer-reviewed journal articles, 8 of which are first and senior authors, 6 abstracts at regional and national meetings. Clinical service, I'm our clinical leader of the division. Fiscal year 2019 saw a 15% increase in patient encounters. Contribution to diversity, as an immigrant from Nepal and a first-generation college student, I know firsthand the importance of diversity and inclusion. I treat everyone with respect and thrive to create an atmosphere of inclusiveness. Teaching, Dr. Smith consistently receives high praise from the residents. Resident scores average 4.5 on a 1 to 5 scale. Comments from residency evaluations include the following, which doesn't fit here in regards to a candidate statement. C, and why is that? There's no data, right? So you could take that statement and apply it to anybody, right? So you take that statement, I'm an immigrant from Nepal, first generation college. I treat everyone with respect and thrive to create an atmosphere of inclusiveness and equity. This statement could be about me. Hailing from Oakland, California, the most diverse city in America, I treat everyone with respect and thrive to create an atmosphere of inclusiveness and equity. Or it could be my daughter. Growing up in Davis, California, where the local co-op grocery store has an ethnic foods aisle, I treat everyone with respect and thrive to create an atmosphere of inclusiveness and equity, right? So really, there needs to be data. So teaching, well, what can you do for diversity and inclusion? Well, this is Dr. Andrew Lee and Dr. Muhammad Ali. And what they did is they created a Ramadan, a guide for UC Davis Medical Center faculty, residents, and students. And then they partnered with medical students here at UC Davis. And then they created an educational packet that introduces faculty and trainees to Ramadan, and then allows them to understand if they have a trainee who's undergoing fasting, what can they do to be supportive, and also to This tells trainees what they can do to reach out to their team members during fasting. This should go on their candidate statement of contributions to diversity and inclusion. This is our class, and look how diverse this class is, both from gender, racial, and lived experiences. So, did you help fight statistics? Did you help create this class? Were you an assigned mentor? Are you a PD, associate PD, or assistant PD? Are you a member of the PEC or CCC? Were you part of the interview committee? Did you help develop this class? These are all contributions to diversity. We have a visiting clerkship here for underrepresented medicine. Did you help with this? I get emails all the time from students who want to shadow me. And then you say, well, I don't have time for this. Well, you create a system. I have the student contact my administrative assistant and set up a 30-minute meeting with me. During the meeting, we talk background and why they want to shadow a surgeon. And then I have them work my administrative assistant to set up a date to shadow me in the clinic or the OR. It's just a system. It's pretty worked out, and it takes minimal effort from my part. Prep Medical, Dr. Godoy is going to try to incorporate this more into our department in the future. Speaking at American River College, many of you get these emails. If you speak at American River College, you're contributing to diversity, because 50% of community colleges in the state of California are Latinx students, and 40% are first-generation college students. So by showing up and talking about what you like to do, you're contributing to diversity. Research. Only 0.25% of senior and authors in high-impact journals are women, and very few are editorialists or editorial board members. How can you contribute to diversity? I just took a random division and random researchers in that division, Dr. Cantor, Dr. Bold, Dr. Sauter, and I looked them up on PubMed, and many of their articles, first authors are women. That's contributing to diversity, because you're helping to overturn. In order to become an editorialist or a board member, you need to publish, and you need to show a track record for publishing. And then have you mentor students, and what are the products of that mentorship, and ultimately, such as Sarah Chin, who matriculated here and become a member of our residency program. And then Dr. Humphreys is doing great work with undergraduates as research pipelines. Professional activity, you can reach out to your alumni associations, and oftentimes they want students to come and shadow you as well. These are some Berkeley students. I've been doing this since I was appointed here. This undergraduate student eventually graduated from our medical school. So going back, we have half our department are professors. That means half our department are Yodas, and they should be training the baby Yodas of our department. That means mentorship, help guidance. So mentorship is important, right? And but many say, well, can I mentor faculty who don't look like me? And in the Me Too era, if I'm a man, can I mentor a woman faculty member? So we don't want it to be chasing ourselves in circles. So we need cross-demographic mentorship. And that means to be a successful mentor, sponsor, or academic coach, an individual does not need to look like the colleague they're helping. They need to understand and acknowledge that particular colleague's professional needs, which may include professional development and training or institutional sponsorship. And if the individual can't directly mentor that person, then they can direct that diverse junior faculty colleague to other faculty members who can fulfill their individual mentoring needs. These are called benevolent outsiders. And then you serve as a connector. So you take your network, your extensive network, and introduce other people to that network. But there could be mentor malpractice. So mentorship is a two-way street. This is a wonderful article from JAMA that looks at some of the mentorship pitfalls. One is the doormat. Mentee is on the receiving end of a manipulative mentor. The mentee's energy is used for things that do not further their career or for which they do not receive credit. How do we solve this? Ask directly how new projects align with goals. If you're the mentor, does that assignment help your mentor, or does it help you? And these are my mentors throughout the years, most of whom are still with us, some of whom are not. And you can see many of these mentors do not look like me or background is any way related to me other than our science or our clinical skill set, but they have been valuable sources of my success. And then finally, sponsorship. You need to advocate and push to hire, retain, and advance. So to really support our junior faculty to get their research out, we've developed a partnership with UAB, which is a UC Davis UAB Visiting Professor Junior Faculty Exchange Program. I'm sure when the UAB folks presented this at their grand rounds, they called it the UAB UC Davis Exchange Program. And then that's to build an academic relationship between the two departments, but provide a mechanism for junior faculty to disseminate their research and expand their networks and learn from other leaders. And then sponsorship also means to tap somebody in the shoulder and give them an opportunity. This is the tweet from Vanderbilt looking at a town hall surgery during COVID-19. And you look at this panel, and that panel, obviously created a lot of controversy. These are Manos, right? This is the web response. And then now we have Meninars, or all-male webinars. And so you need to look to see what you can do to do that. And we find that women oftentimes have a lot of mentors, but they lack sponsors. So your sponsor may not even know you, but they know of you, and they'll pick you for job opportunities or panels. And so you really have to fight Manos. So this is an interesting article that I kind of liked because it looked at the clinical congress over a 6-year period from 2013 to 2018. And the reason why I like this article is because I was appointed to the Clinical Congress Program Committee in 2013. And I kind of know, and I've served with Dr. Farmer for years, and then in my last year, in 2019, I was vice chair of the committee with Dr. Ford. And I know what went behind the scenes to create the sausage there. And so what they did, they reviewed the Academic Surgical Congress and the Clinical Congress, and they found an increase in proportion of women panelists over the study period in the Clinical Congress from 23% to 34%. And the proportion of men-only panels decreased significantly over time at the Clinical Congress from 38% to 23%. And we worked hard to make that increase. And we didn't appoint women to panels just because they were women, but there was a vast network of women who were experts in the field, and they just needed sort of a different perspective to get them onto the panels and moderators. And then if you've served on a search committee, what was the outcome of that search committee, right? Getting back to contributions to diversity, if that search committee led to a diverse candidate, then you contributed to diversity. So in summary, academic medicine is hard. Expectations for merit advancement and promotion. There are resources here, including the Succeed program, and our senior surgeons can be great resources for mentorship and sponsorship. Thank you, and I'm more than happy to answer any questions now or later.
So thank you, Dr. Cooke, for that excellent presentation, a great overview. As you can see, we have, as you showed, we have this very sort of senior-heavy department, so it's so critical to be recruiting new faculty, and I think you'll see announcements coming from me. We probably have anywhere between 6 and 10 new faculty joining us in the fall, and it's absolutely critical. Thank you, by the way, for giving me some hints for my budget meeting, which is coming up on Wednesday, to explain why I'm still hiring all these people in the midst of these difficult financial times. I also want to thank you for doing exactly what I knew you would do when I appointed you to this position, which is bring rigor, bring value, and do the right thing. You've been an outstanding example of somebody who just gets the job done when asked, and this is extraordinary and really needed in our department. I think I could just tell by the questions that I was getting from people like who'd been here for a decade, who didn't know the answers to a lot of these questions. So thank you for the tremendous breadth and depth of what you have brought to this process. And I'm going to say, time to stop giving Michigan credit for it. You took it and you threw it. So I think you could just make a slight side note to that.
Oh, I'll delete the slide.
There you go. We're a bit over time, but I think we have a minute or two for questions here. I think a lot of them can be directly addressed to David and his team that's putting this program together. And before I stop talking, I also want to really encourage people, if they can, to participate, to listen to the TED Talk as you advertise, and participate in the 2 programs coming up this Thursday and Friday afternoons. So any questions from the audience? Questions from our external crowd? Like I said,
Yeah.
perfectly to the point, clear and able to understand. And as I say, I'm sure people will contact you with specific questions as we launch all our new faculty. And thank you again.
Great. Thank you very much.